Right, so it looks like we are ready to get started. I just wanted to say hello. My name is Terry Peterson, and I am the director and instructor for the Medical Coding Specialist program and the Healthcare Administrative Assistant program. This is my 10th year of teaching for Minnesota West. And one other thing I wanted to note is that if you have any questions or concerns or anything that you need help with or just wondering about, go ahead and put it in the chat, and at the end of the presentation I will answer all of the questions. So let's dive right in. I want to explain to everyone what medical coding is and what a medical coder does. As everyone knows, small children love to role play, and one of the more popular games is pretending to be a doctor. You might hear children say, "I'll be the doctor and you be the nurse." But here's what most kids and many adults don't realize. The healthcare field offers a plethora of non-clinical career opportunities beyond being a doctor or nurse. A lot of times people don't think about the administrative side, especially medical coding. If you're asking yourself, what is a medical coder? Well, you've come to the right place, and I'm going to tell you all about it. What is medical coding? Medical coding is the transformation of healthcare diagnosis, procedures, medical services, and equipment into universal medical alphanumeric codes. So to put it simply, this refers to the process of translating important medical information into simple codes for the purpose of documenting medical records and informing accurate medical billing. There are two different types of medical codes primarily used in healthcare settings today. Those are the International Classification of Diseases, or ICD, and the Current Procedural Terminology, which is also called CPT. While there are certainly distinctions between these classification systems, their purpose is similar: to allow for uniform documentation between medical facilities. Having this standard system allows for a more seamless transfer of medical records, streamlined billing, and more efficient research and analysis to track healthcare trends. So, for an example of this, it would be so hard if you were having, let's say your healthcare system was at Sanford in the Sioux Falls area, and they followed a certain coding that they understood among their Sanford clinics. But then you moved to Florida and you were seen at a clinic down there and they had their own system of coding. That would make for very hard, a very hard way of distinguishing diagnosis and the kind of equipment and things like that. And so they came up with these codes where it's used universally so that no matter where you go, every clinic is going to understand the same coding system. So what is a medical coder? Medical coders are the people responsible for translating physicians' reports into useful, uniform medical codes. These professionals work behind the scenes in a variety of settings, ensuring all pertinent information is coded appropriately to ensure consistency and accuracy. After a medical provider examines or treats a patient, the insurance company or government provider needs to understand what was done in order to process the bill. Common language is too inexact to give the insurance company the accurate details it needs. So, a set of specific codes have been established to define medical procedures. It's the role of the medical coder to pass along this information in a way that is useful and efficient. Diagnostic codes. Diagnostic codes are used to determine diseases, disorders, and symptoms. They can be used to measure morbidity and mortality. An example of this are ICD-10-CM, which is International Classification of Diseases, Clinical Modification, which is a standardized classification system of diagnosis codes that represent conditions and diseases, related health problems, abnormal findings, signs and symptoms, injuries, external causes of injuries and diseases, and social circumstances. Procedural codes. Now these are numbers or alphanumeric codes used to identify specific health interventions taken by medical professionals. So for example, CPT, which are current procedural terminology, coding medical services and procedures to streamline reporting, increase accuracy and efficiency, and ICD-10 PCS, which is International Classification of Diseases Procedural Coding System. And those are classifying procedures performed in hospital inpatient healthcare settings. Equipment, supplies, products, and pharmaceutical codes. These are used to identify items not found in CPT coding. For example, HCPCS, or Healthcare Common Procedure Coding System, is a coding set that identifies equipment, supplies, and products such as ambulance services and durable medical equipment, prosthetics, orthotics, and supplies when used outside of a physician's office. So where do medical coders work? You may assume that you know the answer to this question, hospitals, of course, but there are several other settings a medical coder may work. The simple answer is that these professionals are employed anywhere that provides medical services. So this can include hospitals, clinics, urgent care facilities, nursing homes, treatment centers, insurance companies, government facilities, and lots more. There's also insurance agencies that hire medical coders to handle patient claims from the other side of the table, verifying that the accuracy of the incoming claims have the right codes. And speaking of accuracy, some law firms even employ medical coders to help identify billing fraud. What are some of the qualities that medical coders share? So there's no typical prototype when it comes to medical coders. You'll find people of all ages, identities, and experiences. But good medical coders do share some common characteristics that help them on the job. One critical trait is a strong ethical standard because the patient data that they work with is highly confidential. Medical coders must also have a keen eye for detail. One minuscule mistake in a code could lead to a much larger issue. They also must be able to remain focused because their work is rather repetitive, yet extremely important. Additionally, it helps to be efficient and even-keeled, as their work is often tied to meeting production and accuracy-based goals. So let's talk about some of the skills that medical coders should have. There are a handful of technical skills medical coders need to succeed in this field, but transferable skills are important as well. So some of the top technical skills are medical terminology, anatomy and physiology, analytical skills, and are detail-oriented and self-motivated. How do you become a medical coder? Becoming a medical coder requires specialized training and certification. It's not a job just anyone can perform, but that's what makes medical coders valued professionals in the world of healthcare. Although training is essential, the barrier to entry into the health information field isn't as high as other healthcare careers. For example, the Medical Coding Specialist program at Minnesota West can be completed completely online in as few as 3 semesters. This fast and flexible option means aspiring medical coders can fit this training into their busy schedules and be out in the workforce earning money sooner. It's an ideal pathway for working adults with financial and family obligations that are looking to get started in the health information field. When you complete the medical coding program, the next step is to earn your certification by taking a certification exam. This step is not always required, but it is typically favored by employers. I'm sure you're wondering what the career outlook for medical coders is. You've likely heard about the industry-wide growth expected in the healthcare field, so it's not surprising that jobs for medical coders are on the rise as well. The employment of medical records and health information specialists will continue to grow by over 9% through 2030. All right, now the question everybody's been waiting for: how much do medical coders earn? The 2022 median annual salary for medical records and health information specialists was $55,389 annually. Factors such as experience, education, and work setting can also contribute to higher medical coding salary ranges. So, are you considering being a medical coder? You now have the basic understanding of the medical coding definition, what a medical coder is, and the important role these professionals play in the healthcare industry. The favorable job growth and short path to entry make this an appealing option for those wanting to get a start in the medical field. One of the options is to be a remote medical coder. Remote medical coders are medical coders who work from home or locations outside of the healthcare facilities. They process patient information such as diagnosis, services rendered, and equipment used to conduct tests in order to translate it into medical codes consisting of numbers and letters. Billing and coding specialists manage this information so that patients or their billing insurance companies can be billed appropriately. Remote medical coders may be self-employed, or they may work for a large coding firm that contracts with the hospitals or the healthcare facilities. Certified medical coder. As a certified medical coder, you work in the medical records billing department of a hospital or other medical facility. You are responsible for assigning medical billing codes to each treatment and procedure performed for a patient so that the claims can be billed or filed with the insurance or Medicare. You also examine patient records and use your expertise to correctly code all diagnoses and procedures according to the National Medical Billing Coding System. Healthcare Administrative Assistant. As a healthcare administrative assistant, you will perform various tasks on a daily basis. So you should be able to multitask and prioritize. You will be expected to handle sensitive information confidentially. You need to be able to combine exceptional communication skills with an ability to perform behind-the-scenes tasks. Ultimately, you should be able to ensure our medical facility's smooth operation by accurately completing administrative tasks in a timely manner. So, why Minnesota West? Well, Minnesota West offers small class sizes, personalized attention and focus, hands-on learning. Our technical programs provide students with the practical skills to begin successful careers in a variety of industries immediately upon graduation. Liberal arts programs at Minnesota West are a great starting point for careers or further study in numerous fields. Credits earned in our Associate of Arts and Associate of Science programs are designed for seamless transfer to other Minnesota state institutions. Whatever you choose to study, our instructors build that program to lead the student to success year after year. So that is it. I just wanted to thank you so much for coming and listening about the medical coding program. If this is something that you're interested in or you're not sure and you have more questions about, you can sure email me at Terry. It is terri.peterson, Petersen, at mnwest.edu. And I would love to hear from you and any questions you have or concerns that you have. And so let's look through some of the chat questions and see if there's some things we can answer here.